Hello, my name is Julie McCrossan, and it's my enormous pleasure to welcome you to the fourth of our debates here at MSF TV. Today we're looking at the delivery of humanitarian aid in conflict zones, and most importantly, how we can do it better. And I've got four people with practical experience on the ground and a passion for the topic. Let me begin by welcoming Dr. Alan Ryan, who's Executive Director of the Australian Civil Military Centre and a former Principal with the Centre for Defence and Strategic Studies at the Australian Defence College. And Alan has also been a Senior Advisor to a former Minister for Defence. So welcome to Alan. Welcome also to Marion Orchison, who's a Senior Humanitarian Trainer with Red R Australia, who trained people to do work on the ground all over the world. And Marion has recently been working with UNICEF in South Sudan. It's my great pleasure also to welcome Paul McPhun, who's Executive Director of Médecins, Sans Frontières in Australia, and Paul has 20 years' experience in the field. And finally, Lieutenant Commander Joel Hissink from the Royal Australian Navy. He's a medical doctor by background and he's been deployed on Operation Pakistan Assist 2 in 2010. So again, someone with on-the-ground experience of delivering humanitarian aid in a conflict zone. Welcome to all of you. Look, I want to come to you first, Paul, from Médecins Sans Frontières, because everything I read about Médecins Sans Frontières is talking about neutrality, impartiality and independence. Do you believe that is important to maintain in a conflict zone in order to get access to people and give them the help they need? And if you believe it is important, how on earth can you actually do it?
I think it's the fundamental set of principles, internationally subscribed to and fully understood. It's inherently important, primarily for the population and for those that try and assist the population, that we try and respect a certain approach that separates us and provides a space, an independent space within which a population can receive the assistance that they need for their survival in the midst of a conflict, and that actors, whoever they may be, can operate in that space in a way that separates and removes them from the agendas of the warring parties. So that's essentially what we want to try and create, is that opportunity for people to have the direct needs addressed in a way that has no other agenda linked to it except ensuring their survival during times of crisis.
Look, I've got a quote from an MSF document, and it says about Syria. Now, I couldn't think of a more dangerous or frightening place to try to help people on the ground right now than Syria. And it says the primary issue for medical workers and humanitarian organisations today is to obtain from all parties to the conflict, and starting with the Syrian government, the demilitarisation of areas in which to provide care and the routes to supply them. And it's arguing against the notion of a humanitarian corridor. How could you send people into Syria without the support of some form of, armed defenders? How could you stay independent in that context?
Well, Syria is one example, and it's an example that's front of mind for everybody because it's currently very much highlighted in the media. But most of the conflicts around the world present exactly the same dilemmas, and my mind swings immediately to Afghanistan, where we face exactly the same circumstances, and the notion that you can only create a safe area, and an area that provides, like I said, both the population safety and workers who will provide them with the assistance they need, the safety they need to do that. That can only be secured through, a military protection to create that in a physical sense. Is something that we completely don't subscribe to. In fact, you can argue the complete reverse, that simply by having military involved, creating effectively borders within borders of a conflict, that you'll create perhaps a zone, a safe haven or a corridor in which the people that are directly inside of that might receive assistance and might have some modicum of safety, but in no way identifies that population may have the greatest need within that broader context, or that others with greater needs might be able to actually cross those invisible borders, those lines within any conflict setting, and actually access that assistance. And in fact, having a militarized zone within which people can then operate can in fact massively complicate the dynamics and the perception towards people who are operating in the delivery of assistance in those kinds of situations.
Look, let me come to you, Marion, because you've been to South Sudan. Give us a sense of what you were trying to do there for children with UNICEF, how you were trying to help the children, and how you managed being in a conflict zone and staying safe.
Well, South Sudan's a particularly interesting one because it's a protracted conflict that's been going for many decades. And last year while I was there, and again this year, coming out of a civil war and moving into an independence period, which is more calm in the more global sense, but internally very fraught with lots of different military actors. And I think that's an interesting thing to think about with this, is that we're not just talking about formal militaries, we're also talking about other armed actors, whether they're militia groups or different parties to a conflict. So the negotiated space that we're dealing with is not just about formal negotiations with military, it's about day-to-day talking to people on the ground who may be blocking your access for lots of different reasons.
You call it a negotiated space. Tell me more about what you mean. You're negotiating the space to help children for UNICEF.
Absolutely. So in terms of the actual work, it might be providing water for children and families, it might be providing medical care, it might be providing basic services such as shelter. And to be able to physically get into an area where there is conflict or that is controlled by an armed group requires often a constant dialogue with different types of military and armed actors. That's not a simple question of just the principles and no discussion. It has to be a negotiated engagement where we work out the finer details of in what way are we going to get access that's safe for our personnel, but also doesn't inhibit the right of those people to receive assistance.
Look, negotiation usually means compromise. So do you have to compromise independence, impartiality and neutrality to get to the children in South Sudan and help them?
I tend to steer away from the word compromise because I think it has a tendency to push us into feeling bad about the negotiation process. And I think the negotiation and the constant engagement is what's vital. I agree entirely with what Paul's saying about the importance of the principles. From my perspective, I think particularly impartiality, that what we're doing is based on needs alone, that is why we're helping people, and that we're not party to conflict, which is where the neutrality elements come in. But that we are having to manage that relationship, and it is a relationship, it's an everyday thing potentially with the same people potentially over time, that is not about compromise in the bad sense, but about finding practical solutions to ensure you meet your objective, which is to prevent people from dying and to alleviate suffering.
Surely you have to compromise, Paul.
I would definitely jump in there. I'm more comfortable perhaps with the word compromise. I mean, I admit we fail as an organisation. No, we don't necessarily succeed in that negotiation process. We don't necessarily have the means or the answers or the strategies to unfold in a complex conflict. And we
fail in the sense that it's impossible to be always completely impartial and neutral?
Fail in the sense that we can actually put ourselves alongside a patient, and that patient can put themselves alongside our services, and that we can ensure that their survival during times of conflict. I mean, fail in the brutal sense that in the absence of us being there, more people will die. And I think one of the inherent things that we have to absolutely and truly uphold is the notion of impartiality. And
give us an example of what that means. Take me to a conflict zone, and what does it mean?
Well, let's get to the guts of this debate. If you map out where aid has been delivered, not by humanitarian actors, but whereas aid as a supposedly humanitarian action has been delivered by other actors, the military, for example, you will not see that reflects impartiality. Aid will not be delivered in Afghanistan in order to ensure that those with the greatest need are receiving aid. It will be delivered in order to ensure that where military have other objectives, other underlying needs to be in the country, which is pacification or security or development, whatever it is, that aid becomes part of that strategy. Therefore, if you're a member of the population and you look at what's going on in your own country and you say, but hold on, my needs are far greater, why aren't I getting any assistance? You would be going to the core question and saying, is this an impartial agenda? And that's one of the real areas where lines get blurred, and for whatever reason, we end up in very, very complicated...
Where the aid goes. If I could just quote from an Oxfam Australia a report, they did a study of global aid commitments between 2001 and 2008. They found a 40% increase in aid spent in Afghanistan and Iraq. So there was a 40% increase in commitments, but it was predominantly going to Afghanistan and Iraq. And they talked about the growing trend for donor governments to focus on countries they consider militarily and politically important while overlooking severe crises elsewhere. If I could bring you in, Alan Ryan, those figures would indicate that money's flowing to Afghanistan and Iraq because of political and military needs, not simply prioritising who are the people on the globe most in need. Is there anything wrong with that?
Anything wrong with it probably reflects the realities of the situation we find ourselves in. There's a limited bucket of aid out there, and remembering that aid is provided by donor governments and also through organisations, non-government organisations, and they are driven by, I suppose, the imperatives of the day.
What does that mean?
Well, you can call them political imperatives, but we are caught in the CNN news cycle, and money will follow what is obviously out there in the news headlines. So there's an issue there. Now, what we try and do, I think, across the international community, through the United Nations, as a government, is to be fair and open-handed as far as possible. Impartiality, I think, is something that we all should strive for. The issue that we sometimes get within operations is that issue of neutrality. That becomes much harder to achieve, particularly when you're dealing with warring parties.
Explain the difference. What's neutrality, what's impartiality, and why... You know, I'm trying to think, how do we get aid to the people most in need? So how does our understanding of those terms affect our capacity to do that?
Well, impartiality is essentially about being even-handed. And we are governed by the principles of international humanitarian law. And at an operational level, everybody who is involved in an operation, whether they're government or non-government, is obliged to protect civilians. And there's an increasing body of law and comprehension of what's involved in that. And it's starting to shift the way that operations are conducted by civilians, by the military, and by non-government organisations. So on the one hand, we all strive to be even-handed, but you'll find yourself in situations such as in Rwanda, such as in the Congo, such as in South Sudan, where you're dealing with participants of the conflict, which it's virtually impossible to be neutral.
Why?
Why?
Well, is it?
For some organisations, and certainly Médecins Sans Frontières, and also the International Committee of the Red Cross, they are mandated and required to be neutral.
So
and
whoever's
entirely
injured
appropriate.
that you can get near, you help them.
Well, I would argue, the International Committee of the Red Cross is mandated. It's mandated by states around the world, to uphold the values and the regulation of warfare. But NGOs are not mandated. We are not mandated. Nobody mandates us.
Exactly.
We mandate ourselves, if you like. But certainly within the framework of international humanitarian law, we are bound. And this is an interesting part. The military, they are bound to afford the protection and survival of a population where they occupy a space and have a population under their responsibility. So it becomes very difficult to say to the military, well, you don't then have a role to ensure that these people have the means to survive. The interesting point is, though, that if the military were to therefore assume that responsibility, also under international humanitarian law, the regulation of warfare, then they should do so in a very, very distinct way. They should not try and disguise their action as being a humanitarian act. They should not disguise themselves as a civilian unit. They should not, alongside delivering aid, seek intelligence information. And the point I would like to make is, similarly, there's an onus of responsibility on us as organisations, and this is where the lines also get blurred from the side of not-for-profit organisations, is we should not disguise our activities. We should not embed ourselves with military. We should remain completely independent. We should try and strive to remain neutral, and we should try and act in an impartial way. And unfortunately, on both sides, we see that there's been an increasing trend over recent years of blurring of these fundamental principles that safeguard inherently that people have that unhindered access and that we have unhindered access to provide them with assistance.
I want to bring Joel in from the Royal Australian Navy and then come back to you for comment. You went to Pakistan during the floods, Joel, with the Australian Navy.
Yes.
What was your mission, and were you striving to be neutral and impartial?
So we were deployed as part of an Australian medical task force, and it was a whole-of-government approach. So Army, Navy and Air Force was deployed alongside AusAid and the Australian medical assistance teams, and UN had some representation also. So we deployed to Pakistan to deliver humanitarian aid to the 21 million odd personnel who were displaced by those terrible floods. So we were there primarily to provide primary health care, and the whole operation was focused around providing that primary health care to those people in need. Now, I feel...
Is it the role, therefore, of Defence Forces to deliver humanitarian aid?
There is certainly a role for Defence Forces, I feel, and I agree with Paul in that the roles have to be clearly identified, and blurring of the lines is problematic. And in Pakistan, for instance, it was very clear that that's why we were there, and some effort was put into ensuring that the population that we were delivering this aid to understood why we were there. However, there's also military is a tool of government, and the government has various different interests. And I think this the military would approach this from a point of view, or the government would approach it from a point of view of national interests and national strategic interests, and that includes one of the national interests is a stable a global order, rules-based global order, and that's the fourth sort of national interest. It starts with a secure Australia, a secure neighbourhood, a stable Asia-Pacific region, but also a stable rules-based global order. And that's where the military is important in not only delivering humanitarian aid where it's needed, but the humanitarian situation is a symptom of some crisis. And I think
A stable rule-based order in uniform, even if you're doing medical care, surely that's...
That's an absolutely fully defensible argument as to why Australia chooses to act in this way. But that is not a humanitarian act. And let's just be very, very clear. I think we all acknowledge that. That is not. Therefore, when your fundamental reasons to be in a location providing assistance is not only to provide independent, impartial assistance to the population with the greatest need. You have other agendas, maybe pacification, ensuring your own national interests. What that ultimately means is for the broader population, there will be people within that population who don't receive assistance, and they will look at what's happening and they will say, but this is not humanitarian assistance. This is another agenda. And they will look at organisations like our own and others, and they will say, and what is their dual agenda? What are they trying to do? And this risk to the perception that goes against, the fundamental principles of acting in a way completely neutrally and independent of the warring parties becomes blurred, and that puts everybody at
Just
threat.
a point of clarification, I'll bring Marion in. Are you saying that when Joel is giving medical treatment to people in Pakistan during the floods, it's not humanitarian aid? Or that he should not be doing it?
No, I'm saying that if that treatment, if that primary health care serves solely the purpose of providing those with the greatest need with medical care, then for me, absolutely, within the responsibilities defined under international humanitarian, that's absolutely humanitarian act. But when it comes with other agendas, principally the agenda of we're worried about what the population might do, this is a stabilisation effort, we feel it's a threat to our own national interests, that is not a humanitarian
A
act.
comment from each of you, yeah.
Sorry.
No, you go
I was
first,
going
mate.
to say that I think there's an important distinction to make as well. And Pakistan is a complicated case because it is
sure.
both a combat setting and
Yes.
that was a natural disaster. And from the perspective of military engagement in that kind of context, in a natural disaster context, the degree of distinction and the purpose of them being there is quite different to a setting, say, in Afghanistan, where you might be dealing with combat settings, and the line of distinction is much more blurred if the military is then engaging. And I think particularly if we're looking at the Asia Pacific and we're looking at natural disaster and the role of national militaries, but then even potentially the role of the Australian Defence Force in places like Papua New Guinea, there's probably distinctions to be made, and that's why part of that compromise is a difficult thing to say, but there is perhaps less concern that there will be a misunderstanding about the purpose of them being there, and a greater scope for military intervention in a way that's less confronting perhaps, although MSF may not agree at all with that, where it's a natural disaster and there's no conflict involved and there's less possibility or no possibility of the military being involved in order to achieve short-term military goals. There might be much broader national or international foreign policy goals, but it's a very direct distribution kind of thing.
Let me just cut. I just have to cut to the chase. Do you support Australian Defence Forces delivering medical care in Afghanistan?
That one, I don't know that I do, and I think that
and
there's
in a
more
nutshell,
distinction.
why not? Just spit it out.
I think that then we go back to principles. I think there, the distinction between what's humanitarian and what's a military objective is too blurred.
Okay.
I think there needs to be a clearer space in that context for purely humanitarian
I'm going to
engagement.
come to Alan, if I may, and then give you a chance to respond. But I'm trying to keep all our sights on women and children who are hungry, people who are injured, babies who will die unless they get care, and how but they're in armed conflict zones. And so how do we get the care to them while caring about these principles, and what degree of compromise is okay? What would you say?
We support entirely the position of humanitarian relief organisations and international organisations that will adhere to those principles of independence, neutrality and impartiality.
And what about Defence Forces?
Now, the Defence Forces work under different rules, to be honest. As we discussed before, this issue of having a mandate, and that mandate may come from a national government, it may well come from the United Nations, it may be an internationally agreed mandate. So you do find yourself in this situation where there is a definable need and where you're on the ground. Now, I would agree that in certain circumstances assistance can be provided in the context of military operation, and it would be inappropriate to call it humanitarian aid
So what
in
is
the
it?
purest sense.
What is it if you've got civilians and you're giving them medical aid, but you're a member of the Navy or the Air Force or the Army? What is it then if
If
it's
you
not
go back to the
humanitarian aid?
rather rough Vietnam example, they talked about hearts and minds. I think we've become considerably more sophisticated than that, but in many cases on the ground you do find yourself in very difficult moral territory. And there is that situation where what do you do where there's a definable need in your area of operations? Do you not deliver the assistance at all? Do you let women and children and non-combatants die or suffer extreme hardship? And in those circumstances, I think that the response of a responsible military force would be to fall back on the principles of international humanitarian law, which is that they have to provide the required assistance. You can't really stand back and allow a disaster to unfold in your area of operations.
I very much subscribe to the points that you're making. I think one of the fundamental issues here is this. Really, what it comes down to is this question of perception around how you're ultimately perceived by the population itself, and by those occupying powers, those state and non-state actors ultimately. And I understand that there's a clear distinction.
Isn't it as simple as if someone in the Australian Navy uniform saves my baby's child, I'm going to feel better about Australia?
Yeah, that's absolutely the case. But I'll give you an example. The reason we operate in Afghanistan today, the reason we have hospitals around Afghanistan in some of the most conflictive areas, is because if I choose to go to a hospital that is funded and created and managed under the protection of the coalition forces, my family will be interrogated by the Taliban or other actors. I will be immediately at risk from having identified and associated myself with one of the warring parties.
Yes.
Similarly, if I go to a clinic or a school or an institution under the control and management of the Taliban or other actors, similarly, coalition forces will seek to use me and my family as an opportunity for intelligence or suspicion around exactly who I am and who I'm identified with. That's the core issue of not having the perception or even the true objective of ensuring neutral and impartial assistance in that kind of environment. So by simply creating a neutral identity, an independent identity where you have no other agenda than simply the provision of care, it allows those same people to come to that same facility offering the same kinds of services, but in a way that doesn't then put them under the spotlight and interest of one side or another.
That very reason we operate under a set of agreed international guidelines called the Oslo Guidelines. And under those, there's an appreciation that the military is not the preferred deliverer of aid and assistance, and will only do so when it is absolutely required to do so, where it has the capability to do so, and where the emergency is of such a nature that they will then step forward.
I was about to say, these Oslo guidelines, don't they essentially say don't use Joel for humanitarian aid except, and then they give all these exceptions, acute necessity. You're the only people with the capability to do it. You're the only people able to do it quick enough to save lives. And also if the host government invites you in. So there's
That's right.
some form of civilian control. But all those necessities surely must apply in almost every conflict zone.
Well,
you
they
go
do,
to.
and some of these conflicts we've been talking about are very complex, and the military is often an enabler to secure the environment to enable humanitarian aid to be delivered. And in that process, when we're the first on the ground and we're securing the environment, we deliver aid during that process. And so we are actually, it's important in some of these conflicts to secure the environment to allow Médecins and Frontières and other NGOs and international organisations to come in and deliver aid in a secure environment. And the roles need to be clear. And for instance, in Timor-Leste in 2006, the military was required to, was invited by the government to assist in settling the civil unrest and securing the environment. There were many displaced people around Dili, and the military was in fact asked by many NGOs and international organisations to provide a secure environment. Now, in that situation, it's quite difficult because you have a limited resource, and each of the NGOs wanted to be able to work in a secure environment, and there was the military then had to spread its security forces wide, and whether you have a static security force supporting one particular NGO or you have a roving, more mobile security force, which was required. The complex situations and communication is the key, and that's where I think, so certainly in Timor-Leste in 2006, the civil-military cooperation team was integral in ensuring that the NGOs and the military and all other organisations communicated and cooperated to save people.
Let me just, Paul, if I may just come in for 1 second, because we have a relatively short period of time left, and I want to move, we're talking about how can we improve our response to those in need of humanitarian aid within armed conflict zones. And so I want to move to, what can we do to improve our response? And I'm interested in the description we've just had from Joel, the complexities of what he's described. The military could be involved in decisions which effectively decide who gets help and who doesn't. And I'm just wondering, what are your recommendations for future action? What do we need to do better so that the impartiality and neutrality principles you hold so dear can be maintained to the maximum degree possible? What's the way forward?
Well, I think it's been stated that, the military assume this responsibility for the provision of assistance to populations when there is no recourse to any other means available to them. Now, that is very often, just simply not the way that they are, promoted to actually undertake their responsibility. And we see that repeatedly where we work. And not only the military, what we now see also is states outsourcing the responsibility to deliver aid actually through commercial enterprises. Again, so is that an impartial act? No, you're actually telling someone where you want them to deliver aid based on whatever agenda you happen to have, and it might not be the needs of a population. So for me, moving forward, I really think that humanitarian organisations have a responsibility to fundamentally strive to achieve the principles. We need to revisit the principles around which we negotiate, as was clearly explained. We negotiate this space within which we can remain independent and ensure that a population has that independent access to assistance that doesn't come with the risks associated with the blurring of the roles and responsibilities of who's doing what.
And there's one other element I just want to bring in, which we haven't mentioned, which is the cost, because there's been considerable international and national reports that when you go in with your people, it's up to 8 times more expensive as a way of delivering humanitarian aid than if an NGO goes in. So there's that cost dimension too about where the government is choosing to put its money.
I was going back one step before cost. I would say I certainly think within Australia and overseas as well, when we're talking about, well, how can we do things better? One of the key things that we've seen, both in sorts of organisations like the Civil Military Centre, but also organisations like where I work with Red R, training people who are going to go into this work so that they know the principles fundamentally, that they are that more professional, for want of a better term, in their engagement, that this is not just people with good intentions showing up, that we are people who, as humanitarians, understand the principles that we must uphold, and that our counterparts in military understand them as well, and that we create space for dialogue like this, where we get to understand the terminology and what we all mean, and that we follow through in that in the practical sense.
Well,
on
give
the
us
ground.
a practical example of how, if everyone's properly trained and briefed, you go into an armed conflict zone. Give me an example of how you might make a decision as a professional about the delivery of help.
With South Sudan, one of my roles was to work as a liaison officer for the Office for the Coordination of Humanitarian Affairs with the military. And it was cases, say, the movement of fuel in case to allow operations of all varieties to continue because the country had run out of fuel. And it was a question of armed escorts for that fuel. So it is a question of compromise and negotiation on a day-to-day basis. We didn't want an armed escort. The NGOs stepped back. The fuel was unmarked. It was paid for by them. It was in drums that were not necessarily identifiable. And in the end, we were forced by the national authorities to have a national armed escort. So there were lots of compromises involved. And the end result was that fuel got to where it needed to get to, and there wasn't a problem in terms of the fuel being attacked. But there were compromises made. But
Now, explain to someone who's fresh to all of this why all that talking before that fuel went down the road, even though it caused delays, it may have damaged populations, why was it important to still have the conversation?
in that context, there was actually, within some of the communities, a very strongly held belief that there was a direct link between a militia group that was operating in that area and the United Nations, and by virtue of the United Nations, the NGO community, because we all drive around in the same big white vehicles. If you don't create space and distinction between that, you open the NGO community up to conflict, to attack potentially. You create a perception within the community of distrust, and you inhibit the long-term capacity to actually meet needs and to get access to that community. So we had to create space for the NGO community, particularly, to avoid that perception problem of them being engaged with a military force, essentially.
So it's more training for staff before they go, and it's more of these public conversations. I just want to slip in my admiration for you as a person actually being there in South Sudan. But Alan, Ryan, your recommendations for the way forward, how we can improve our response.
I think it's important to recognise that we are actually doing this at the moment. This fora here is a very good example of the consciousness raising that's being done. But we conduct at the Australian Civil Military Centre, together with international counterparts and together with non-government and humanitarian relief organisations, we conduct training, we do education, we do lessons learned activities, we construct publications. We have one called Same Space, Different Mandates, which sums up what we've been doing here today. We do joint exercises with a good many of the participants, and it's very important to do this because it's not about saying, oh, well, we do them in the context of things like the Talisman Sabre series of exercises, which is conducted every 2 years. The military run a lot of exercises. What we're trying to move to is more whole of government, more whole of nation exercises that aren't necessarily branded military. And to do that, we need to have a lot more goodwill. But I see us building that. We would not have been having this conversation 10 years ago. And you know, I hate to make this a plea for more resources, but I have to say, building the cross-agency, the multi-agency and the international dimensions of this is really an investment in efficiency and effectiveness when we hit the ground. Because the reality is, once you're on the ground, you can't construct it. It's too late.
Look, thank you.
I was going to say, I think Alan has really made a good point there in that education and cooperation is so important, and exercising together before a conflict or before a disaster is really key. And the military is certainly very used to exercising, and we exercise for lots of things, and including disaster relief. And you know, I think one of the unique capabilities of the military is that we have the ability to deliver enormous amounts of aid, whether it's resources, personnel, equipment, very quickly, and it's a unique capability to defence, and we can do it very, very quickly. And yes, it's costly, but we can get it there and establish a secure environment and sort of pave the way.
I just want a final comment for you, Paul, because the primary recommendation for future improvement in the way we respond to humanitarian need in armed conflict is role clarification, training and joint exercises. Yet, where does that fit with this passion that you have for impartiality, neutrality and independence?
It sits here. As long as worldwide the world's leaders continue to promote aid as a soft weapon of war, which is written into military doctrine, use aid as a means to further your military and strategic objectives. Although I fully subscribe to the best practice that we talk to today, and I actively participate in here with my colleagues around the table, and I really think that is of huge added value for the practitioners in the field. But as long as at the top, that doctrine of aid can be a soft weapon of war, aid organisations can be our force multipliers to, like we said, win those hearts and minds, then we'll always face the contradiction between what we all subscribe to in theory and what we have to deal with, as you described very, very well with your example, in practice.
Look, I think this conversation has assisted the kind of literacy of the community watching our discussion to understand the complexity of getting fuel down a road and babies and children helped. I want to thank all our panellists today on this fourth and final MSF TV discussion. All four debates and discussions can be seen on MSF TV's site in coming weeks and months, so I urge you to go there. My name's Julie McCrossan. Thank you so much for joining us, and we look forward to the next adventure with Médecins Sans Frontières and all the other players who've been represented over this month. Thank you very much.